Thanks, Ron. Well, having a beautiful bouncing baby is the dream of millions, but that journey isn't always easy. Some parents-to-be need a little help along the way, and that's where our next guest comes in. Dr. Anil Pinto is with ReproMed Dallas. He offers a comprehensive and affordable approach for male and female infertility evaluation and treatments. And Dr. Pinto, we say thank you so much for being on GMT today.
Thank you for having us, Amy.
It's
appreciate it.
You're welcome. It's an important topic, and there's really great innovations in this field, and those who have a history of genetic disorders now have an opportunity to have a special process done to ensure that they don't pass that disease along to their child.
That's so very right. In an IVF cycle, as the embryos develop, we have the opportunity to go in and take a small sample of cells from the embryos, and this does not impact on the embryo's surviving or the ability to implant in the womb. We can then go in and study these cells and select the better embryos or the unaffected embryos for transfer into the womb. And pregnancy is born from this process. It's called Pre-Implantation Genetic Diagnosis, PGD in short, are highly unlikely, it's not 100%, but highly unlikely to be affected by the disease in question.
That is so wonderful and so nice for those parents-to-be to calm their nerves about that. And I'm sure as a physician, it's really cool to see this kind of innovation.
Absolutely, absolutely.
Okay, well, let's talk about egg freezing. It's been in the news a lot. I really want to elaborate on this new treatment.
Great. I want to backtrack a little and talk about traditional IVF. IVF basically is a science wherein we facilitate egg and sperm interaction to form a baby. For decades now, we have the ability to have successfully had millions of pregnancies born to frozen embryos and frozen sperm. But when it came to freezing eggs, science met with a stumbling block. The human egg is a very fragile tissue that does not survive the freeze and thaw very well.
Okay.
Thanks to innovative science and developments in the fields of freezing techniques called cryogenics, we can now offer our patients at the ReproMed Fertility Center in Dallas. We are offering egg freezing, wherein 95% of the eggs will survive the freeze and thaw, and successful pregnancies are absolute a reality.
Wow, and even I love that you even just brought this with you today. You brought this model, and Carrie and I have firsthand information of what the inner workings are, but we were even asking kind of what all the parts were, and you can sit down with a mom and dad-to-be and kind of go over how this process takes place, how you harvest the eggs.
Correct.
And how it all works. Okay, so who would be a good candidate to come in?
Well, when you talk about egg freezing, the very first group of patients that come to my mind is a young cancer patient. These patients, we well know, following their cancer treatment, be it radiotherapy or chemotherapy, renders them sterile. These patients need to be offered egg freezing.
Okay.
On occasion, sometimes a patient, due to moral, ethical, or religious reasons, will restrict how many eggs they want to be fertilized and have supernumerary embryos. They're struggling with these embryos.
Okay.
So what we do to these patients, we take the eggs that they want to be fertilized, fertilize those eggs, and keep the remaining eggs, and we freeze them for use subsequently. And I think we should not forget the career-oriented women. Many of women nowadays are very successful. They tend to delay childbearing.
Yes.
And I think it's important for them to appreciate that as we age some, so does our fertility potential go downhill. These patients should be urged to come forward and have the eggs frozen when they are young, such that they can use it at a later time in their life.
Sure.
And pregnancy outcomes are excellent.
And success rate is important to note. It's a very successful procedure.
In fact, the success rates in terms of pregnancy outcome to frozen eggs is fast approaching and nearly equivalent to conventional or traditional IVF.
That's fantastic. Dr. Pinto, you're helping so many families. Thank you so much for bringing this information to GMT today. All right, if you'd like more information, you can call this number, 214-827-8777, or log on to this website, drpinto.com. Thanks, Ron. Well, having a beautiful bouncing baby is the dream of millions, but that journey isn't always easy. Some parents-to-be need a little help along